Hi everybody, Oxford Facebook followers. My name is Matt Ernst. I'm with Oxford Physical Therapy. This is my son Patrick. Patrick's a 10-year-old baseball player. Patrick plays catcher, some third base, and some outfield. And what we're here today to talk about is common throwing injuries. We're into almost June now. I can't believe the time's gone so fast, but baseball's been going on for a little while, and some little leaguers might be starting to get some overuse. And so if you hear complaints from your son or daughter or thrower that they're starting to have pain in their arm, we're going to talk a little bit about that today. So Patrick's a right-handed thrower. A common area that young athletes start to complain of pain is right on the inside of the elbow. And people will commonly call this little leaguer's elbow. And one thing to be aware of in young athletes and in kids, before they're skeletally mature, before their bones harden, the growth plates are actually soft. So the muscles and ligaments are stronger than the bone, and they can actually start to cause the bone to pull apart there, which can start to contribute to that pain. So things to look for is a sudden onset, a pop, or a sudden pain here on the inside of the elbow. That would be something to be a little bit more concerned about. Most of these things start slow over time. So a lot of times young athletes are motivated because they love the sport and they love to play, so they don't want to tell you when they hurt. They don't want to tell you when things are going on. So you might have to probe and ask them a little bit. If your little leaguer starts to complain and hear pain on the inside of the elbow, first best thing is some ice locally to the area, and bring them by to one of our locations. We have 24 locations across the city. OxfordPhysicalTherapy.com lists all the locations, and we can do a free injury screen. Our trained clinicians can take a look at your little leaguer and tell them, how their elbow's looking, if it's something that requires attention via physical therapy, or we can make an appropriate referral for that. Additionally, athletes will sometimes complain of pain back here in the shoulder, okay? So posterior shoulder pain, pain around the scapula, the shoulder blade. Again, in young athletes like Patrick, they're going through big growth spurts, and bones grow quicker than muscles. So as bones elongate and grow, the muscles struggle to catch up. And so you have, go ahead and hold the ball there for me, buddy. So you have this long lever arm back here to throw, and now you have these muscles that are trying to control something so far away, and these bones have just gotten longer in the last number of months because maybe they went through a big growth spurt. So an area that we work a lot on with young athletes is on the muscles around the shoulder blade. You can kind of see here, actually Patrick's shoulder blade sticks out just a little bit, so the muscles that we need to be really strong are the muscles around the shoulder blade, the middle trap, the rhomboids, the serratus, muscles that control the shoulder blade here. So that gives a good stable base of support for the arm and shoulder to work off of when it gets up here to go ahead and then load and throw a baseball or throw a ball like that. I want to show a couple of just real simple stretches or exercises that can help to kind of stretch out this part of the arm. So again, with that medial or inside of the elbow pain, Patrick, if you put your glove down there, commonly just having the athlete take their hand back this way. So go ahead and hold to this side, hold this way, and not just the fingers, but hold in the wrist and palm and bring it back that way. You should feel it stretching or pulling down here. Is that where you feel it, buddy?
Kind of.
Okay. Turn it a little bit this way, you might get a little more. Is that better?
I don't feel it.
Okay. You're not hurt there, so that's why you're probably not feeling a whole lot of stretch. Patrick goes through a warm-up routine, so he stays pretty healthy with throwing. But I'm going to show you a couple other things. So commonly, again, take the arm just this way across your body, buddy. And this is kind of stretching that posterior capsule of the shoulder. Okay. Throwers tend to get limitations into internal rotation and tightness in the back part of their shoulder here. So that helps keep this area loose. And then go ahead and lay on your right side for me, Patrick, up on the table. Put your head up at that.
Like this?
That's fine for now. And so, here, fix your feet, get comfortable, buddy. Bend your knees a little bit. All the way over on your side, and then take this hand. We want to bring this arm down towards the table. Good. Just that way. And so this stretch can be done laying down, or if you were at the ball field, it could be done up against the wall, leaning this way, and just kind of stretching down that way. So I think we got a couple of questions here, some frequently asked questions to go over.
Yes, some frequently asked questions about Little League injuries and throwing. First one is, what do I do if my little thrower has pain?
So again, kids are more likely to push through a problem, so they don't often want to complain about it. So if they're already complaining, chances are it might be going on a little bit of time. So first thing I would want to know is how long has it been going on? Ask them good questions about when it started. Simply some ice to the area locally, just putting some ice right onto the area where it's sore. And then remember the injury screens that we offer. Stop by any one of the locations and we can take a look quickly and kind of let you know if it's something that needs attention or not.
Awesome. Another question is, when do you use heat or ice?
That's a great question. We get that question a lot. Typically my answer is ice for pain or ice after activity. So after the game, if it's sore, ice is the best thing to use to treat. Ice is an anti-inflammatory, so it helps local inflammation. Heat's something to use for stiffness. So most kids aren't going to have stiffness or achiness. If they do, that's when heat would be most appropriate.
Awesome. What are the best ways to prevent these type of injuries?
The exercises there, the stretches are good. Really preventing throwing injuries this time of year starts in January. So working on strengthening exercises, and we can help teach athletes those exercises. Specific ones like we talked about to build up the shoulder blade. Making sure that you're following pitch counts. One thing people don't think about is pitches count in practice, pitches count in warm-ups. So always keeping an eye on your throwers and how much they're throwing. Positions that people don't think about, they look a lot at pitchers, but they don't think about catchers. They don't think about shortstops, people that are throwing a lot of reps there. So make sure you're following pitch counts, make sure you're resting in between, and a little bit of cross training. So don't go playing in a rec league, in a select league. Make sure that you're kind of paying attention to how much your athlete's throwing from a prevention standpoint.
Next one is, how do I know if my athlete can play through it or not?
Yeah, that's a great question. I don't advocate kids playing through a lot of pain. Again, we have to be really careful with kids because the muscles and tendons are so strong in this area that they can actually start to pull the bone away, and they actually get almost like a fracture created because the muscles are so strong. So in my mind, with kids, especially kids this age, 10 and under, 12 and under, even early teens, pain's a pretty hard stop. I don't usually advocate playing or pushing through a lot of pain in young athletes.
Great. How long should I wait before going to the doctor?
That's a good question. We get that question a lot. Again, I think physical therapy is a great first treatment for this and a first intervention. So Kentucky and Ohio both allow direct access, so you can come straight to a physical therapist without a prescription. Then we can take a look at things and decide if we need to make a referral or get you set up with a qualified physician we work with. But early intervention is best. So if it's a pain or a soreness, give us a call, stop by, let us check it out.
Last question. How long will my little athlete be in therapy, and when can they play again?
That's a great question. Depends on severity. Early intervention is the key. So the sooner we get to treatment, the sooner things get better. Normal soft tissue healing time's 21 days. So 3 weeks will generally get you through most soft tissue injuries. Although if it's been a lagging problem, it can go on a little bit from there. But in this type of an injury, we have two things to look at. We have the treatment, so getting over the pain or problem, and then the return to activity. So this is usually going to involve a return to throwing or a graduated throwing program. So they usually won't go back to where they were. They'll need to build up to that level. So it can take a couple of weeks, 4 to 6 weeks, to get back to the normal level, depending again on severity.
Great. And for anybody watching right now would be the time to send us a question. If you do have any more questions, I would refer you to our website, oxfordphysicaltherapy.com. And is there anything else that you guys want to add before we leave?
I don't think so. Hopefully this rain holds off and we get to play Patrick's game tonight.
All right, Patrick, are you having fun today?
Yes.
Are you going to stretch before your game?
Yeah.
That's right. All right, thank you guys.
Thanks a lot.